ECC webinar hosted by the ECC Programme Office for the counties of Cavan, Donegal, Leitrim, Monaghan and Sligo. My name is Lynn Stoddard. I am the General Manager for the Enhanced Community Care Programme for these counties, and I will be your MC for the webinar today. This is the third webinar in our local ECC webinar series, and the aim of our webinars is to highlight the objectives of the Enhanced Community Care Programme, which is part of the Saolta Care vision of delivering right care in the right place at the right time. Our first webinar hosted on HR process and documentation, and our second webinar gave a broader overview of the ECC programme, introducing the community healthcare networks, which are the foundation blocks to the delivery of care in the community, our integrated care teams for older people, and our chronic disease hubs, and the linkages with our colleagues in acute and general practice in the community. This evening, I'm delighted to be going live from the Errigal Chronic Disease Hub in Letterkenny. Chronic disease management is one of the key enablers of health and morbidity management. The programmes are being progressed through the Enhanced Community Care implementation groups and governance structures, and I'll talk more about that. We'll be exploring the role of the chronic disease hubs in treating people with chronic cardiac disease, respiratory conditions, and type 2 diabetes, and the way in which GPs, hospital consultants, and other clinical professionals can interact and integrate with the hubs to the benefit of our population and service users. This is a very ambitious programme under Saolta Care. There's been a significant investment in our community services, and it really is the shift left from everything being delivered in the acute hospital to building that capacity within community to deliver it close to where people live. It will take time to implement. I suppose the focus has been on recruitment to date, and we're delighted to say that a lot of our posts are in place. It will take time to get the services set up, so we'd ask that you would be patient, and as the services develop, we will be communicating referral pathways, care pathways, etc. with you. So tonight you will be introduced to Claire McGrory and Fiona Gilliland, the operational leads for chronic disease who manage the hubs in Donegal. That's Claire and Fiona in Cavan. Our chronic disease lead in Sligo, Suzanne Keenan, is off at the moment, but is represented here this evening by Karen Spratt, administrator for the hub, and that's called the Ben Bulben Hub in Sligo. We're delighted to have Dr. Paula Armstrong, President of the ICGP and a Donegal-based GP on this evening, and he will talk about the GP role. Maeve McKeown is our self-management coordinator across our 5 counties, and she will. We are delivering from the Errigal Hub tonight, and just to say that the services are up and running, elements of it in the Ben Bulben, and Cavan is at the early stages as well, and Fiona will talk to that. So just a few housekeeping points to note for today's webinar. It is being recorded, and this recording will be made available to view on the Community Healthcare YouTube channel. If you have registered for the webinar using your email address, you will be sent a link to the recording once it has been added to the channel. Please note that the video will only record the panellists on screen and not the audience members or chat feed. For our audience attendees, you will note that your audio and video is turned off, and this is just to help us to assist in managing the online event more smoothly. There will be a question and answer session at the end of this webinar. During the webinar, you can put your questions into the chat box for answering at the end. A frequently asked question document will be produced following today's session. As we may not have time today to address every query raised, we will be circulating that in the coming week or so. If you do have any technical issues or questions during the event, please post a message to host in the chat box in the bottom right, and we will do our best to respond to your comment or query. I've just had a note that there was an interference when I was introducing Maeve McKeown, who's the self-management support coordinator for our area. So tonight, unfortunately, Mandy Doyle is the head of primary care, but is unable to join us tonight, so has asked that I would introduce on her behalf. So Mandy is the head of primary care, which includes the oversight of the chronic disease management hubs and community care healthcare networks in our area, as both these elements sit under primary care. In our area, we have 8 operational community healthcare networks which have all gone live, and delighted to say that we have a GP lead in each of the networks, just except Leitrim at the moment, and that's being worked on. The network managers are all in post and they're establishing their network teams. We've been setting up chronic disease management hubs in Cavan, Donegal and Sligo with specialist teams providing care for people living with type 2 diabetes, cardiac disease and respiratory conditions. Each hub also has a network of spokes, satellite clinics where the specialist teams can facilitate patient care close to service user homes. And you can see the little lady trying to navigate all the services that are being stood up. And as I said previously, it is a very ambitious programme. The hub in Sligo and Donegal have diagnostics on site, and it is intended this will be on site in the future in the Cavan hub also. There is great work underway towards integrating our chronic disease management hubs with geographically aligned hospital services and with the general practitioners community. This integration is supported by the development of the community healthcare networks and by the implementation and governance groups whose purpose is to drive delivery and implementation of the chronic disease management model of care to better. Suzanne Keenan is our operational lead in the Benbulben hub in Sligo, covering the Sligo, Leitrim and West Cavan areas, as well as a small part of South Donegal. Unfortunately, Suzanne could not be with us today. However, Karen is here to represent the hub. So you're very welcome, Fiona and Karen. Claire McGrory is our operational lead here in the Errigal hub, covering the majority of Donegal. The 3 areas are at different stages of development, with the Donegal hub somewhat more advanced due to Saolta care projects and the long-term conditions programme, which has been in operational for a number of years. So this is why our Errigal hub is our focus for the webinar this evening, and it demonstrates the model in action and what we're working towards. This evening, Claire is going to demonstrate the benefits of integrated working through the hub and spoke model. 4 videos have been produced to show the day-to-day clinical operation of the hub and the benefits of the integrated model to service users attending the hub. Claire, I'll hand over to you. Thank you.
Thank you, Lynn. And welcome everybody to the Errigal Chronic Disease Hub in Letterkenny. I'm delighted to be able to share our work with the wider audience, and particularly with GPs and other clinicians who will be interacting with more and more as the programme and our referral pathways develop and expand. I provide the operational management for the chronic disease management services, which include the respiratory, diabetes and cardiology teams. Clinical management and clinical supervision is provided by the relevant therapy managers or heads of discipline. The Errigal CDM Hub is a clinical site outside of the hospital setting which supports individuals living with chronic disease throughout Donegal and offers access to services and specialist teams both here in the hub and in community locations close to their homes through the provision of spokes clinics at community sites within the 4 community network areas throughout Donegal. The hub is an integrated service delivered 80% in the community and 20% in the acute setting, which forms tangible links between primary and secondary care. The Hub CDM teams consist of various multidisciplinary members who offer an integrated service for patients to include nurse-led clinics by the CNSs and AMPs, that's for respiratory, cardiology and diabetes, dietetic clinics for diabetes, podiatry clinics for diabetes, physiotherapy-led clinics for respiratory, community pulmonary rehab for respiratory, community spirometry service, which is not yet operational here in Donegal, but will commence when equipment is procured and recruitment is complete, and community cardiac rehab for the cardiology service, which again will commence in 2023 when staff are onboarded and recruitment has completed. We also already provide access to diagnostics through our community echo service, and this is the cardiology service, and our Chief Cardiac Physiologist, Owen Sheehy, is online with us here in the hub this evening. The community echo service is provided here in the Errigal CDM Hub and also in community locations within the 4 network areas, and it allows GPs direct access to cardiac echo for the diagnosis of patients with suspected heart failure. Kathy Farrell, who's our heart failure AMP, will go into this in greater detail later in the webinar. We also are extremely lucky to have the provision of a radiology suite here in the Errigal CDM Hub, and This hopes to be fully functional by January of 2023, and although not necessarily linked to the CDM Hub, the fact that it will be on site here will offer ease of referral for patients who are attending the Chronic Disease Management Service, and it will also reroute all plain film X-ray referrals from GPs to the CDM Hub rather than to Letterkenny University Hospital, thus reducing the flow to the acute setting. The Chronic Disease Service is focused on providing patients with the tools to empower themselves to self-manage their chronic conditions. In order to achieve this, we work closely with GPs and hospital consultants to develop pathways and protocols that assist patients in attaining this. The clinical reporting relationships are with the GPs whose patients we are seeing in primary care and with the consultants in secondary care whose patients we are seeing there. Each service has developed pathways and protocols working closely with the hospital consultants and the GPs to ensure that patients have rapid access to specialist consultations when it's necessary, be that in primary or secondary care. To reiterate what Lynn said earlier, I think it is also important to note that today we're presenting to you from the Errigal CDM Hub, which is very much based on our story to date in Donegal. Each of the hubs throughout Cavan, Donegal, Sligo, Leitrim and Monaghan, and indeed throughout the rest of the country, are at varying stages, but given time and with the necessary resources, we all have big plans for the future for chronic disease management. We're extremely lucky here in Donegal to have such a great hub from which to provide our services and a wonder team of specialists who work together to minimise the effort required by service users while maximising the service we can provide to them. Today, I'm most excited to show you a number of promotional videos that demonstrate that service in action. I have with me 3 of the AMPs who work within the CDM service and are so vital to the provision of these services. All of these ladies are unbelievably dedicated to each of their specialisms and are the driving forces behind the development and expansion of services here at the Errigal CDM Hub. Antoinette Doherty is our respiratory AMP, who has assisted in the development of the integrated respiratory service in Donegal to date and has just recently completed a highly successful proof of concept community virtual ward project, which has been overwhelmingly positive in terms of patient outcomes. Kathy Farrell is our heart failure AMP, who has led out on the development of the hugely successful heart failure service within Donegal, and she's a key member of the team in driving the cardiac care programme within Donegal and indeed countrywide. Kathleen Creerand is our diabetes AMP, who has been instrumental in the development and improvement of diabetes management throughout Donegal and is a champion of service improvement and patient empowerment. All 3 specialists are change catalysts and are hugely passionate about the work that we do here in the Hub. I'm going to ask each of them to introduce the videos that cover their areas of work and to tell you a little bit about each of their services.
I'm Antoinette Doherty. I'm an advanced nurse practitioner in respiratory integrated care, and it's just fantastic to be here this evening telling you what we're doing here in Donegal from a respiratory point of view. So the nursing and physio-based respiratory teams services in Donegal in its current format is changing and transitioning into a new look respiratory integrated care service that will offer standardised and equitable service throughout the county for patients with respiratory disease. And this has been made possible by the recruitment of additional staff, and it will allow for better network covering. The first thing we're going to do in 2021-2023 is to create a straightforward single point of referral through the Chronic Disease Management Hub for respiratory services. We know that's an issue with GPs, and it's quite confusing. So this form will have everything on it, and there'll be a signposting algorithm which will assist with the service intervention best suited to the individual being referred. Patients will continue to attend the service here for a comprehensive respiratory assessment and care plan, but if indicated, onward referral will be to the appropriate individual in service, will be within the service, will follow on from that. So sometimes you'll refer a patient into the service, but we may find when we've assessed the patient that another individual within the team will best suit that individual patient. So we'll just automatically refer that patient on to that individual. So when we finalise the format and the new form and the pathway and run it through the implementation group, we'll come back to you with a communication and relevant information in respect of how to access our service. Sorry, a wee bit nervous. And now, without further ado, I would like to introduce you to the promotional video we did here back in the middle of October, and it just outlines some of the services, and it just gives you an idea what a patient would see and what a patient would do when they come through the doors of the Chronic Disease Management Hub here in Letterkenny. Thank you. Hello, my name is Antoinette Doherty. I'm an advanced nurse practitioner. I work in respiratory integrated care here at the Chronic Disease Management Hub in Letterkenny. The brief of respiratory integrated care is to screen patients who have a suspected disease, respiratory disease, and also to manage people with a known respiratory disease such as asthma and COPD. So if I take the patient with the suspected diagnosis, we have to assess those patients and do further investigations to confirm the diagnosis. The mainstay of our investigations includes spirometry testing. A spirometer can inform us of the flow and the measurements within the lung volumes, and from those numbers we can stage the level of disease and confirm a diagnosis of COPD. And if we've used reversibility, we can confirm a diagnosis of asthma. Individuals newly diagnosed with COPD will have further assessments. We'll be measuring their symptom burden, we'll be measuring their level of fitness. This may include a 6-minute walk test, which is measuring their breathlessness score and their oxygen level as they walk a distance, and we measure the distance they've walked in the time frame of 6 minutes. Once we've concluded our assessment, we formulate an action plan. Our action plan will include a review of medication and optimisation of medication, and there we're going into the territory of inhalers. There's a plethora of inhalers available to these patients. Sometimes the patients have been prescribed inhalers that are difficult to use and inappropriate for their level of disease. So that's a case of reviewing their current medication, assessing the patient and how they take their inhaler, and seeing if we have something in the same category or a different category if indicated, and start that patient on the new inhaler. So it's a big part of the job is getting the right medication for the right patient with the right level of disease at the right time.
My name is Pauline McFadden. I'm a clinical nurse specialist in respiratory integrated care, and I work alongside Tara Cooper, senior physiotherapist. We deliver an 8-week pulmonary rehab programme in the community setting. This programme aims to improve patients' functional exercise capacity and quality of life by providing education, advice and support to help self-manage their chronic condition.
Well, the first thing I want to do is express my gratitude, the fact that the service is actually there for us. The access to the nurses, they're unreal people. And I would honestly say without them, I wouldn't have the life I have today. I really appreciate that.
Hello, my name is Kathy Farrell and I work as an advanced nurse practitioner in heart failure here in the Errigal CDM Hub in Donegal. Our team work in an integrated way with 20% in the acute hospital and 80% in the community setting. This allows seamless integration across primary and secondary care, where patients who are seen in the community clinics can be discussed with the consultant cardiologist in the hospital if required, and patients who are hospitalised for heart failure can have their follow-up in clinics in the community closer to their home. We hold clinics currently both here in the hub in Letterkenny, but also in 5 community locations around the county, where patients can have their specialist nurse review and the echocardiogram if needed in one appointment. One of the key successes to our service is having that multidisciplinary team of clinical nurse specialist, advanced nurse practitioner, cardiac physiologist and clerical support. The ANP role allows a higher level of decision making in the community setting, reducing the number of patients who need to go forward to be discussed with the cardiologist, and having a cardiac physiologist based in our community team allows for the diagnostics such as echocardiogram to be performed in community clinics, but also provides a service that monitors patients with implantable devices at home, which can detect early signs of clinical deterioration, allowing early intervention by the nursing staff. So far, we've had over 260 GP referrals for assessment, with 75% of those having been diagnosis of heart failure confirmed. The waiting time for review is between 2 and 6 weeks, depending on the clinical criteria, but with an average wait of 26 days. Of these patients who've been referred in, over 75% has been managed in the community between the GP teams and the cardiac specialist teams here in the hub. About 20% are then discussed with the cardiologist regarding further management, and 5% have had to see the cardiologist in the acute hospital. The nursing clinics provide education on the patient's condition, self-management strategies, and we optimise the patient medication to allow patients to self-manage in the community. We've provided over 1,500 nurse visits this year so far, with 150 of them being unscheduled reviews, where patients have initiated the contact with increase in symptoms as they've been thought to do, and that is a key marker of hospital avoidance. We do believe this has led to reduced admissions. With the first year of service, there was 65 less heart failure admissions to Letterkenny University Hospital than there had been in previous years, and that equates to a cost saving about €400,000. We look forward to further development of our cardiac team in primary care, with cardiac rehabilitation in 2023 and further expansion of cardiac services and diagnostics delivered in the community once we have an integrated cardiologist appointed. I'm delighted to introduce our short video demonstrating our services and happy to answer any questions at the end.
Hello, my name is Kathy. I work as an advanced nurse practitioner for heart failure here in the Errigal CDM Hub. We take referrals from GPs for those with suspected heart failure and triage them according to set criteria and see them where I take a history, a symptom history, full medication, physical assessment, and then work with my cardiology physiology colleagues to look at the diagnostic test to formulate a diagnosis and treatment plan. I work along with my clinical nurse specialist colleagues, cardiac physiologists and clerical staff to provide a nurse-led clinic in the community settings. This reduces the number of patients that have to travel to Letterkenny where they did previously, and we've cut down patient travel time by about 77 kilometres per patient per visit. We also have a nurse-led service to respond to patient-initiated contacts where they have increasing symptoms so we can intervene and avoid hospital admissions. So far in 2021, we showed a reduction in hospital admissions that coincided with the establishment of this service.
Hello, my name is Owen Sheehy and I'm the cardiac physiologist here in the Errigal CDM Hub. So I work as part of the integrated cardiac care team, and my role is primarily for cardiac diagnostics. So we take direct referrals from GPs for assessment for cardiac heart failure. I perform echocardiography, which is ultrasound scans of the heart, and we also provide some diagnostic tests on the heart as well, such as ECG. I also provide a home monitoring service for patients with cardiac defibrillators. So these are patients that have known heart failure, and they have monitors in their house which allow us to interact with the patient. So it gives us an early warning sign that the patient may be becoming decompensated, so we can intervene early in the patient's care, and this will avoid hospital admissions.
I like coming here because it's a relaxed place, and they make you feel relaxed, make you feel good, you know, with highly efficient staff.
My name is Kathleen Quirins, and I work as one of the Diabetes Advanced Nurse Practitioners, and I'm part of the Diabetes Integrated Care team based in the Errigal CDM Hub in County Donegal. Our diabetes team is multidisciplinary, including diabetes nurse specialists, dietitians working in diabetes management and prevention, and podiatrists. We work closely with our colleagues in primary care. Referrals are primarily the CNS service from the GP and practice nurse team to attend clinics and structured education in diabetes programs such as the Desmond program. Referrals are received in the hub and triaged, and all appointments are allocated within a 6-week period of being received. We also have pathways where patients can attend the nursing service with self-reported increase in symptoms, prompting either a virtual, phone, or face-to-face review by the CNS or the advanced nurse practitioner. In the first half of this year, 198 patients were reviewed in an unscheduled episode of care, which is a direct indicator of hospital avoidance. Our service is the hub and spoke model, providing clinics in primary care centres throughout the county, as well as in the hub, allowing people to be seen by a specialist service locally, reducing the need for patients to attend hospital services, including the travelling. The diabetes nursing team work across primary and secondary care, with both teams improving integration and facilitating patients' discharge and follow-up locally from hospital and endocrinology services. The aim of our service will be to provide a multidisciplinary service to support patients with type 2 diabetes, from prevention to patients with more complex needs in an appropriate time frame in a setting convenient to their home. I'd like to show you now a promotional video we recently completed, which will give you a small insight into what services the Diabetes Integrated Care Service provides.
Hi, my name is Sheena McCarry and I'm one of the clinical nurse specialists in Diabetes Integrated Care based in County Donegal. My role as a clinical nurse specialist in diabetes, 80% of that role is based in primary care and the other 20% is based in the hospital. This allows us to work in an integrated manner because we have close links with our endocrinologists and the diabetes team within the hospital and our GPs and practice nurses in the community who are responsible for the patient's diabetes management in primary care.
Hello, my name is Caroline McConnell. I'm one of the senior dietitians working in the South and East Network. I work with patients predominantly with type 2 diabetes, and my main role is to bring care for patients closer to their homes and within their community. Within my role, I provide one-to-one dietary and lifestyle education to patients with type 2 diabetes.
It's much easier than heading up to Letterkenny. So I find it very, very good.
Hello, my name is Kathleen Clearand and I am a registered advanced nurse practitioner in diabetes in integrated care in County Donegal. My role involves being able to see patients with type 2 diabetes with complex needs. These patients were patients who would have been referred into the consultant endocrinologist and previously would have had to be waiting months or years to be seen for an opinion or a consultation or a review. The end point for the patient means that they have access to a more specialised service for the management of their type 2 diabetes in a more timely way in a setting which is closer and more convenient to their home.
My name's Kiva. I'm one of the dietitians in the Chronic Disease Management Hub. I work as part of the diabetes team. I provide podiatry care for patients at risk in remission of the diabetic foot ulcer.
I like it because I can see both the diabetic nurse and the podiatrist in the one place, and I think it's a great service.
A big thank you to Antoinette, Kathy and Kathleen for joining us today and giving us an insight into their services. And also to Zara McGee, who's our diabetes podiatrist, Owen Sheehy, our cardiac physiologist, and Tanya Doherty, our project officer, who have made themselves available to be online with us tonight as well and answer any questions at the end. Referrals to each of the services within the CDM Hub are currently received by various forms, email, e-referral or post, and when received, each referral is triaged by the team, and if it is accepted, patient details are put on a waiting list and an appointment is scheduled based on priority. If it's not accepted, then a letter outlining this and the reasons why is sent back to the referrer. Our referral processes are something that we're currently reviewing and refining, and our aim is to have an e-referral pathway in place for all services as we move forward. This is a work in progress and it will take time. And we look forward to continuing to engage and communicate with all our stakeholders in the future around this and to continue to build upon the service that we have developed to date, which has had a very positive impact for the patients living with chronic disease in Donegal. I'll hand you back to Lynn now. Thank you.
Thank you very much, Claire, for the very comprehensive section on what's happening here on chronic disease management in the Errigal Hub. And just to note that we have over 100 attendees on the webinar this evening, so thank you all for taking the time out to join us and to learn more about the services and the ECC programme. So now I'm going to hand you over to Dr. Paul Armstrong, who is one GP in Lifford and also the president of the ICGP. Paul would discuss the GP Chronic Disease Management Programme, what it provides and how it has been phased in. So over to you, Paul, and thank you.
Thank you, Lynn. I think you have 3 slides from me there somewhere. So just to outline, because quite a number of people on this call are obviously not GPs or practice nurses and just may not know what the complementary service is within general practices. So there's also a chronic disease management program there, which confuses things a little, but this is a chronic disease management for practices and for patients with a number of diagnoses which are outlined there: asthma, type 2 diabetes, COPD, and cardiovascular disease, including heart failure, ischemic heart disease, stroke, TIAs, and atrial fibrillation. So these are essentially the people who got a diagnosis but are stable. And it's a planned program which was introduced over the last year or 18 months, negotiated by the IMO and with involvement from the ICGP. So just the next slide, please. Some points to make about it. Firstly, the practice nurses are really centrally involved in this throughout all the practices and are doing a huge amount of work, because there's a very, very substantial workload in this. There are a lot of blood tests, a lot of things to follow up, ensure referrals are being done, examination is done, certain criteria are met before returns can be made. So it has been a big task for general practices coming out of COVID, and it's gone on, certainly from the public's point of view, silently in the background, although the patients who are engaging with it are extremely pleased and positive about it. But it's certainly a very big workload. Just to make some points about it, it is GMS medical card only, so that's different from the CDM. One of the differences from CDM that we're talking about in the hubs, which is universal, there's no distinction between private and public. This scheme currently is only for medical card patients or those with a doctor visit card under any of the criteria, whether age or whatever. I understand that some of the private insurers are expressing an interest in it, and it may be extended to other parts of the population. Another point to make is that it is a voluntary scheme for practices, so there may be a small number of practices that are not engaged in this. I think nationally it's about 92% at least have signed up for it, but there may be a number. I'm not sure in Donegal whether any practices are not involved, but certainly most of the practices that I'm aware, all of the practices that I'm aware of, are delivering on this group of patients. There's also just another point to make is that there is a national variation here. Like, some parts of the country are a little bit further ahead than us, and some are further back. And for example, in Cork, I've heard very positive stories about it from GPs who are really delighted with its progress. And I think the feedback we're getting from patients and about our current interaction with the hub in Letterkenny, and I'm speaking because that's my area. I know in Cavan, Monaghan and Sligo, Leitrim, it may be different, but it's extremely positive. Like, patients and colleagues are very, very happy with the quality of the information they're getting back and the feedback that we're getting from patients referred into the different service, Kathleen or Antoinette or Kathy or Pauline or colleagues. So that's it. I just wanted to fill people in. That's the cohort of stable people in the community who are being managed on a major preventative program. That slide there just shows the roll-in over the last couple of years. So it did start with just the over 70s, but then went to over 60s, and particularly in 2022, the huge volume, because it included all patients over 18 with chronic diseases. There are also other elements to it, which is opportunistic case finding of patients, maybe with a single risk factor, for example, hypertension, who can actually have a series of blood tests done. And then if they, for example, get a particular diagnosis, they are enrolled then in prevention programs or in the actual chronic disease program. You can see, and just a reminder to colleagues here in general practice, that in 2023, the age criteria changed. So there's more work coming down the line. But this is another program that's getting fantastic feedback from patients who really enjoy engaging with it. That's the end of just what I wanted to present about the GP end, Lynn.
Okay, that's great, Paul. Thanks very much. And I suppose an absolute crucial element is because the GP is kind of the cornerstone of delivery, and your practice nurses have been delivering chronic disease management for a number of years, and I know our nurse specialists, I know certainly Kathleen has been around a lot of the practices in Donegal, and certainly Katrina and Patricia down in Sligo, and likewise in Cavan. So there has been that support there for a number of years. So it's great that it's now within a national programme for rollout, which is very much welcomed, I'm sure. Thank you for that, Paul. So I would just like to now introduce our final speaker this evening before we move on to the question and answers portion. Maeve McCone, as I said earlier, is the Self-Management Support Coordinator for our area, working under our Health and Wellbeing. I suppose within the model of care for chronic disease, self-management support is very much linked with the GP services and is designed to support service users to live well with chronic disease in their day-to-day lives. And I suppose there is that whole thing around self-care and promoting that. So particularly for the prevention of chronic disease exacerbation. So I just say, Maeve, thank you very much for joining us, and I'll just hand over to you now. Thank you.
Thank you, Lynn, and hi everybody. So when we talk about self-management of chronic conditions, we're talking about the tasks that individuals with chronic conditions must undertake to live with these conditions. So for the individual, this incorporates not only medical, but also psychosocial and emotional management. Self-management isn't about the person going it alone, but it's based on a collaborative relationship with their healthcare team, acknowledging that managing chronic health conditions in isolation from what is a much more complex human picture is reductive. I'm not sure if you can forward the slides there as I talk, Lynn, thanks. So self-management support is the systematic provision of education and supportive interventions then to increase patients' knowledge, skills and confidence in managing their health. The National Self-Management Support Framework shown here outlines outlines how we in the health services have a vision for self-managing, supporting people to self-manage their chronic disease through collaborative relationships, supportive interventions and whole system integration. So self-management support interventions measurably reduce unscheduled healthcare attendance, as well as improving quality of life and clinical outcomes for patients. For this reason, actively supporting our patients with chronic disease to self-manage throughout the entire trajectory shown here of their conditions from onset through to end of life is a responsibility of all clinicians in chronic disease management and general practice. So the next slide, please, Lynn. This is embedded within the integrated care and GP chronic disease management programs. So self-management support is not a once-off intervention, nor is it the responsibility of one particular member of the healthcare team. The next slide again, Lynn, please. So a self-management support coordinator supports implementation of the National Self-Management Support Framework across the community healthcare area. Through membership of the chronic disease implementation groups, this role will progress the embedding of self-management support actions within ECC chronic disease pathways of care and will assist clinicians to deliver on their responsibility to support self-management. So for clinicians, understanding the role in this regard is the first stage. Knowing about and engaging the suite of resources available is the next step, and this will be addressed now. Most of the resources which I'll reference are all listed in the ECC resource documents, which those of you working in the hubs will be familiar with. Another source is the Self-Management Support Digital Hub, which is shown here. That's the web address there. And this hub has a section for patients and one for healthcare professionals. And it also houses 2 service directories, which have been developed for this area and cover Sligo, Leitrim and Cavan, Monaghan. They can be accessed through this web page as well. So clinicians can practically support their patients to self-manage in a number of ways. And just while you're pulling up that web page, Lynn, I'll go through some of the ways which we as clinicians can support our patients to self-manage by referring people to the key condition-specific self-management programs for their condition, namely cardiac rehab, pulmonary rehab, and diabetes structured patient education. By using national clinical programme approved self-management tools with your patients, and the examples of them are the Heart Failure Traffic Light Guide, the Heart Failure Fluid Tracker app, the COPD Communication Card and Self-Management Plan, and the Asthma Action Plan. By providing patients with key national clinical programme approved information for their conditions, like the Diabetes Foot Care leaflets or booklets and the COPD and Me booklet, and the Step-by-Step Through Heart Failure booklet. So also linking patients with the relevant national voluntary organisations for their condition, and linking them with non-medical sources of support within their community via social prescribing. Supporting health behaviour change through MEC interventions, availing of opportunities to upskill ourselves, but through key modules on HSE land, for example, the chronic disease management and GP practice, and MEC, and there are lots of other resources on HSE land. And crucially, through signposting patients to the Living Well programme. So for the next slide, I'll discuss the Living Well programme. So Living Well, it's a free HSE programme for adults with any chronic health condition and those with multiple chronic conditions. So participants are supported to develop a toolkit of self-management skills, which they use to break the symptom cycle of chronic disease. Tools include action planning, problem solving, decision making, collaborative working with healthcare providers, management of polypharmacy, and many others. It's delivered in a structured, evidence-based, peer-led format, delivered over 6 workshops of 2.5 hours a week. So it's available online, and in limited capacity, it's available in person as well. So recent results from an independent research project by Trinity College Dublin into Living Well across 5 CHO areas with Sláintecare funding, led by this area, it must be said, corroborate an existing large repository of similar evidence, and they demonstrate significant increases in quality of life, health-related quality of life, self-efficacy, physical activity levels, and the perception of supports available to manage health, and significant reductions, crucially, in depression, in levels of clinical depression, in illness interference in overall social roles, and a 35% reduction in GP attendance at 6 months post-completion. So this last finding is substantiated by qualitative data which indicates that reduced GP attendance rate is brought about by the increased confidence and resourcefulness that the participants develop during the programme. We have some testimonials if we can get the slides up again, but otherwise I'll move on, that's fine. So access to the Living Well programme is by self-referral through contacting Helen, and again this information will be on the final slide, which you'll have access to later. The local Living Well coordinator can be contacted by phone or by email. Health and social care professionals and GPs are asked to signpost and encourage their patients with chronic conditions to register for the Living Well programme. This can be done by giving them a leaflet, directing them to the webpage, which is hse.ie/livingwell. Alternatively, people can contact HSE Live for information about registration. And just to say that the HealthLink referral is pending for Living Well, we're working on that nationally. So that's my piece, Lynn. Thank you.
Thank you, Maeve. And there was a wee technical glitch here, so well done on talking through those. The slide deck will be circulated. Orla's just pulling it up now. Sorry about that, but Maeve has talked through this. This will be in the slide deck that will be circulated, but there is a slide here just on the service user feedback that we said we would just share now as well. So look, thank you very much, Maeve, and well done on talking through that. So we've now covered for our webinar so far today, we've covered our focus areas, which was chronic disease management in primary care, the chronic disease hub and operation, and the self-management support for chronic disease. So we're now moving to the question and answer session. So before we do that, I'm conscious we've all been sitting for some time now. So if everyone would like to stand up and just kind of get a bit of movement going so that you're ready and energized for the next section. And just remember your cameras are switched off if you're feeling any way self-conscious. Some questions have come up in the chat box so far and have been answered by some of the panel members. So please feel free to either enter your question in there, or are they able to raise their hands, Orla? So if you want to pop your questions into the chat box. Thank you very much for your interaction and for your very relevant questions there tonight. We really appreciate it. The poll is open for feedback, so if anybody, you'll see it up there at the side if you want to just kind of highlight how you find the webinar, but also if there's other subjects that you would like covered in future webinars, just to pop it in there. So look, on behalf of the wider ECC Programme Office, I'd like to thank you for all for attending this evening's webinar. The attendance has been very good and I hope you all found it useful. As I said at the start of the session, we will be hosting further ones. So this will be recorded. So for those that weren't able, because we had double the amount that registered, so they will receive the link to the recording, as will everybody here, and also the presentation from tonight, with some additional slides with additional live links that will bring you to other websites that will be very useful for you. Just to say, look, this webinar would not have been possible without the support of our comms team in CH1, the hard work of the chronic disease operational leads, and I know Fiona's on the line and Karen's on the line from Sligo. Just to say thank you very much. This is happening across all the areas, and there's substantial work happening, and please be patient. You know, it is a new service that we're getting up and going, along with the community healthcare network model and the older persons. So all boats are being raised here. It is very ambitious. I think that's what Paul had said, and it is actually happening. So, which is very, very positive. But look, there are kind of enablers that are required, like ICT systems, etc. And we are working with our digital colleagues around getting solutions in place. And we wanted to make it as streamlined for yourselves that are referring, but also to the patient, because that's what it's all about. You know, a streamlined service. And like that point that was raised, that if somebody comes in, that if they have heart failure, that there is a system that we can, you know, that they're seen by the team, and certainly enabling that to happen where possible. So look, thank you very much to the expertise of Dr. Paul Armstrong, Maeve McCone, self-management support, to Claire McGrory for her excellent video for the ECC programme rollout, and thank you on behalf of Mandy Doyle, the head of primary care. Thank you for your dedication in implementing this ambitious programme to improve services for our population. Special thank you to Orla, who's works at the ECC office, for her great organisation for this evening. So thank you and goodbye from myself and the rest of the panel here today. Thank you.
Thanks, Lynn. Thank you. Claire, everybody.
Thank you.
Bye-bye. Thank you.